بسم الله الحمد لله والصلاة والسلام على نبينا محمد وعلى آله وصحبه وسلم. Inshallah, today our lecture in responding to symptoms in the pharmacy practice, we will discuss insomnia. Insomnia أو الأرق بالعربي. Temporary insomnia is common and can often be managed by the pharmacist by giving an O2C products. These O2C products to aid sleep, including the antihistamine, diphenhydramine, and promethazine, are useful in periodic and transient sleep problems. However, these products are advertised directly to the public, and the pharmacists report difficulties in declining sales for continued use. One of the problems of the advertisement of the medicines and drugs will face you as a community pharmacist. An initial focus on sleep hygiene and careful explanation that antihistamines are for short-term use are therefore important for you as a community pharmacist to advise your customer or your patient regarding the use of antihistamine for management of short-term insomnia. Now we'll talk about the physiology of sleep. Usually, sleepers pass through 4 stages: stage 1, stage 2, stage 3, and stage 4, which is called rapid eye movement, abbreviated by REM, rapid eye movement sleep. These stages progress cyclically from 1 through REM, then begin again with stage 1, the cyclic stage. This is stage 1, stage 2, stage 3, REM, then from the beginning stage 1, stage 2, stage 3, and REM, and this will be in cyclic pattern. A complete sleep cycle takes an average of 90 to 110 minutes, with each state lasting between 5 to 15 minutes. The first sleep cycles each night have relatively shorter REM, rapid eye movement sleeps, and longer periods of deep sleep, but later in the night REM periods lengthen and deep sleep time decreases. These sleep cycle stages: first, stage 1, in which there is a light transitional sleep. The patient feel drowsy and then sleep begin. Then stage 2, followed by stage 2, in which there is more stable sleep, in which your body, the body, secretes chemicals which block the sense, making it difficult to be woken. Then stage 3, which is deep sleep, in which there is a secretion of a growth hormone released. This is very important, especially in children. Then the last stage, stage 4, اللي هي REM, rapid eye movement sleep, in which there is revitalizer memory, ذاكرة نشطة, in which dreams, intense dreams, can occur at this stage. REM, rapid eye movement stage, is the stage of dream, because due to the revitalizer memory. Stage 1, eyes are closed, but it's easy to wake up. This phase may last for 5 to 10 minutes. Stage 2, there is a light sleep, the heart rate slows, and the body temperature drops, getting ready for deep sleep. This is the previous stage for the deep sleep, in which occur in stage 3. This is a deep sleep stage, stage 3. It is harder to arouse during this stage. During this deep stage of non-rapid eye movement sleep, هم الثلاثة, the 3 stages, stage 1, stage 2, stage 3, can be called as non-rapid eye movement sleep, because stage 4 is called rapid eye movement sleep due to the rapid movement of the eye at this stage. The body repairs and regrows tissues, builds bone, muscles, and strengthens the immune system. As we mentioned, the secretion uh, of the growth hormone is a characteristic of this phase or stage. Then the last stage, stage 4, or rapid eye movement sleep. The first period of REM typically lasts 10 minutes. Later cycles of sleep stage, we have that rapid eye movement stage gets longer, and the final one may last up to an hour. Heart rates and breathing quickens at this stage. Intense dream, as I mentioned, may occur during REM sleep since brain is more active. Babies can spend up to 50% of their sleep in REM stage compared to only about 20% of adults. What you need to know as a community pharmacist regarding insomnia as a symptom in the pharmacy practice, that commonly the customer or the patient can come to you in the community pharmacy, complain of insomnia, of different types of insomnia, as inshallah we will mention. You should know the age and the symptoms. Is there any difficulty falling asleep or walking during the night, or early morning walking, or poor sleep quality, or there is snoring, snoring, or the duration, the previous history, previous episodes of insomnia, and the contributory factors. Shift working, such as shift working, is a contributory factor, or being away from a home. Also, we will talk about the sleep hygiene in more detail. Then last, we will talk about the medication. First stage, in elderly people, the total duration of sleep is shorter, and there is a fewer sleep stages. Nocturnal walking is more likely because sleep is generally shadwa is in elderly. However, people may still feel that they need more sleep and wish to take a medicine to help themselves. So that you will notice that in your home, your grandfather or grandmother have the ones who are the mostly woken earlier are the grandfather or grandmother, because there is an the elderly, the sleep stage will be decreased by the age. Elderly people may nap during the day, and this reduces their sleep need at night even further. Also, to having a nap, قفوة في النهار, this may also reduce the sleep need at night. Many babies and infants have poor sleep patterns, which can cause anxiety to their parents. In this situation, Revere can be helpful. If there is insomnia in babies or infants, this is a direct indication for Revere. You should know the symptoms. It is important to distinguish between the different types of sleep problems. We have different types of sleep problems. These include difficulty in falling asleep, and this is called sleep latency insomnia. Difficulty in falling asleep، في صعوبة في إنك شخص ينام بسرعة، sleep latency insomnia. And the second type of sleep problem is walking during the night, or the third, early morning walking, and or the fourth, poor sleep quality, and the last اللي هو snoring. Depression is an important cause of insomnia, so that you should ask by questioning the customer or the patient. You can suggest if there is an depression or an anxiety, and both of these can be associated with insomnia. Depression is an important cause of insomnia. Early morning walking is a classic symptom of depression, especially if the patient have a symptom of early morning walking. This is a classic symptom of depression. Here, the patient may describe no problems in getting to sleep, but walking in the early hours and not being able to get back to sleep. This pattern requires referral to the doctor for further investigation, as this customer patient may suffer from depression. Also, anxiety can cause insomnia. This is usually associated with difficulty in getting off to sleep, sleep latency, insomnia, because of an overactive mind. It is sometimes this is something that many people experience, particularly before an important occasion such as an exam. If, however, this occurs as a more regular pattern, if it's transient for 1 or 2 times, it may not need treatment. But if it's occur in more regular pattern, referred to the GP should be offered, because this patient may suffer from anxiety and need more investigation and more treatment. You should know the duration of insomnia. Sleep disorders are classified as transient if it take days, 3 days, 5 days, 7 days. This will call transient insomnia. Short-term insomnia, which take up to 3 weeks, can be called or named as short-term insomnia. While chronic insomnia, that is insomnia that persists for longer than 3 weeks. All chronic cases of insomnia should be referred to the doctor. If the customer or the patient that describe he have a chronic or have a insomnia that lasts for more than 3 weeks, this is a direct indication for a referral. You should know the previous history. It is worth asking whether this is the first time problem in sleeping have occurred or whether there is a previous history of insomnia. Where there is a previous history, it is helpful to know what treatments have been tried for treatment of that insomnia. It is also useful to be aware of a history of depression or anxiety or some other mental health problem. These are contributory factors. The contributory factors that can contribute to insomnia. First, the shift work with changing shift is a classic cause of sleep problems. Those who work away from home may have trouble in getting a good night's sleep because of the combination of traveling and staying in unfamiliar places. Also, alcohol. While 1 or 2 drinks can help by decreasing sleep latency, because alcohol pharmacology can be classified as sedative hypnotics, but the sleep cycle is disrupted, can be disrupted by heavy or continuous consumption of alcohol. So maybe chronic or excessive alcohol consumption is a contributory factor to insomnia. Also, the life changes can be cause disrupted sleep, such as change or loss of a job or moving to a new house. This also can be a contributory factor that contribute to other stressful life events might include exam, job interviews, celebrations, and relationship difficulties. Also, the contributory factor for insomnia. Obesity can be associated with sleep apnea and snoring, both of which can interrupt sleep. Snoring and obesity, apnea and snoring can interrupt the sleep. It's worth asking about the factors known to contribute to effective sleep hygiene to avoid or to minimize or to reduce these contributory factors. Regarding medication, you should ask your customer or the patient about the medication he already used, because we have a lot of drugs that can contribute to insomnia. This include decongestants, nasal decongestants, which contain pseudoephedrine or propanol, vinyl propanolamine, or ephedrine, fluoxetine, selective serotonin reuptake inhibitors, and monoamine oxidase inhibitors such as phenylazine or tronylsobramine or minabrine, corticosteroids, appetite suppressants, phenytoin, and cyuphilline. Medical problems can be associated with insomnia through pain. This include angina, arthritis, cancer, and gastroesophageal reflux. Or breathing difficulties also can contribute to insomnia, such as the congestive heart failure and chronic obstructive airways disease and asthma. All of these breathing difficulties also can contribute to insomnia. Other medical conditions such as hyperthyroidism and Parkinsonism disease can also cause insomnia. When to refer the patient who suffer from symptom of insomnia, if there is a suspected depression, if there is a chronic problem, insomnia that lasts for longer than 3 weeks duration, or in case of children under 16 years of age. The treatment time scale, there should be an improvement within days after giving him an O2C medication, diphenhydramine or promethazine. Refer after 1 week if the problem is not resolved. Now we'll talk about the management. We have an O2C antihistamines, diphenhydramine and promethazine. Antihistamine reduce sleep latency. The time sleep latency, as we mentioned, the time that taken to fall asleep, and reduce nocturnal walking. They should be taken 20 to 30 minutes before bedtime and can be recommended for adults and children that over 16 years of age. Tolerance to their effects can develop, and they should not be used for longer than 7 to 10 consecutive nights. ما بنستخدمه أكثر من 7 ل 10 أيام متوالية مع بعض. Following a 50 mg dose of diphenhydramine, there is a significant drowsiness for 3 to 6 hours. Then you know that drowsiness will help encourage sleep, so that they are useful for sleep latency insomnia. Diphenhydramine and promethazine should not be recommended for pregnant or breastfeeding women. We have also an O2C complementary therapies. These include plant ingredients such as valerian and hops. Some patients prefer an alternative treatments for insomnia, perceiving them are more natural. Here you will find a lot of customers that believe in the natural products or herbal products because they believe they are more natural and they are free of adverse effects. Herbal remedies have been traditionally used for insomnia with we have valerian and hops being the most used ingredients. They are not recommended for pregnant or breastfeeding women. There are no report of side effects of these products. They are available as capsule. This is sleep relax with valerian and hops. Regarding also the complementary therapy, we have aromatherapy. Aromatherapy is the use of aromatic plant extracts and essential oil in massage or bath. It is effective in aiding relaxation. We have a lavender oil and chamomile oil. Lavender oil has shown to induce a sense of relaxation, as has chamomile. Both of them induce a sense of relaxation, and this can help sleep and maintain sleep. 1 or 2 drops of essential oil sprinkled on a pillow, or 3 or 4 drops in a warm, not hot, bath can be recommended to induce sleep and to treat insomnia. This is lavender oil and chamomile oil. We have a melatonin. Melatonin is currently available only as prescription only medicine in UK. However, it's widely used in the USA to treat insomnia. Melatonin, as you know, is a natural product that produced by the body pineal gland during darkness, and it's thought to regulate sleep through acting on melatonin receptors, M2 and M1 and M2 receptor. Supplementation with melatonin can raise levels and help to restore the sleep pattern. Melatonin has a short half-life, 2 to 3 hours, and is subject to first pass metabolism, so that it's available as sublingual controlled release, or are therefore popular in the USA. Now we'll talk about sleep hygiene. We have practical points. First, these practical points should be the patient or the customer that suffer from insomnia or disruption in sleep pattern. You should give him advice regarding these practical points. First, you should advise him to establish a regular bedtime and walking time. يعني ينوم في وقت معين ويستيقظ في وقت معين. Establish a regular bedtime and walking time. Consciously create a relaxation period before bedtime. No meals just before bedtime. No naps during the daytime. This is for the patient who suffer from insomnia. But the ones who doesn't suffer from insomnia, no need to prevent him from naps during the daytime. No caffeine after lunchtime. Reduce because caffeine is a CNS stimulant, so that can cause insomnia. Reduce extraneous noise using air pulse if necessary. You should reduce extraneous noise by, if necessary, using an air pulse. Get up if you can't sleep. Go back to bed when you feel sleepy, tired. Restrict nicotine intake immediately before bedtime. This is because nicotine is a stimulant that can result in insomnia. A warm bath 1 to 2 hours before bedtime can help to induce sleep. Not immediately, 1 or 2 hours before the bedtime. The stimulant effect of caffeine in coffee, tea, and cold drinks is considerable, so that avoiding caffeine in the afternoon and evening is sensible advice. Actually, there is regarding the effect of caffeine, there is an individual variation. Some of the individuals they can drink caffeine and they can get sleep. Some of them, if they drink caffeine in the afternoon, they will cause insomnia, even insomnia at night. So there is some individual variation, but you will concern about the patient who suffer, or the customers that suffer from insomnia. You should ask them to minimize, to avoid caffeine consumption in the afternoon and already at night. Now we have a case. We have Chris Jenkins, a 20-year-old student, comes into the pharmacy requesting some tablet to help him sleep. He says that he has had problems sleeping. He had problems sleeping ever since he returned from Indonesia 10 days ago. He says that he can't get off to sleep. معناه هو he suffer from sleep latency insomnia, because he does not feel tired. When he eventually does fall asleep, he sleeps fitfully and finds it difficult to get up in the morning. He has never suffered from insomnia before. He is otherwise well. He is not taking any medicine and does not have any other problems or difficulties. What is your recommendation? It's clearly this is Chris Jenkins suffer from transient insomnia due to the recent traveling. Chris suffered from a short-term insomnia due to his recent traveling because long-haul travel can result in disruption of sleep pattern, and some people are more affected by it than others. بعض individual affected by this and others not affected. It would be reasonable to recommend that Chris take an antihistamine, diphenhydramine or promethazine for 4 to 5 days until the problem resolved. An alternative would be one of the herbal products to aid sleep, such as valerian oral hops. He should find that his normal sleep pattern is re-established within 1 week. If not resolved or re-established after 1 week, you should refer him to the physician. That is all regarding this symptom, insomnia. Thank you for listening.